Welcome to Injury Influence Unpacked. I'm Ryan from Injury Influence Academy, and this is the podcast for physios and physical therapists. We share practical tips and real-world stories to help you thrive. Let's unpack it together. So today we've got a talented young physio, Luke. Luke, great to have you on board, mate.
Thank you for having me.
No problem at all. So this is our very first podcast episode for those who are tuning in. We're going to chat to Luke about the importance of application of anatomy, as well as the importance of assessments and testing. So Luke, kick us off today, mate. Just tell us a bit about yourself, a bit about your background, your current role, your journey in physio, things like that, mate. The floor is yours.
Yeah, awesome, mate. Wow, okay. My background. So I guess if I take it way back, growing up, I've been, a big footy player, so league. I've been involved in league my whole life, my dad has, and being around league, I guess not necessarily that I took an interest in the human body, how it works, kinematics, etc., but more importantly, I was injured all the time. I just could not stay healthy growing up for some reason. I don't know, genetics, mate. That's the go-to.
Common thing with physios.
Yeah, that's about right. We're always injured, aren't we? But no, I was always injured, and I had a really good physio actually growing up. A gentleman out of Warner named Nick. He was quite talented, I figured, and he always seemed to get me back on the field quite quickly. And I was like, wow, like this guy really gets me, and he really gets me back to where I want to be quickly. And I just thought, what a profession, right? Like if I can help people get back to what they want to do as quickly as I can, or I guess just as efficiently as we can, get them back to what they want to do, that's something pretty cool. And I guess that's where it started, I guess, my love for it.
Nice.
Yeah.
And what about your journey, like fast forward a little bit, like your journey into physio, like where did you study, what did you do, what did you find interesting, that kind of stuff?
Yeah, definitely. So I moved to Sydney straight out of high school, and I was interested in physio at this point. I moved to Sydney to play some footy down in Cronulla. And when I was down there, I reached out to the team physio, Barry Shan, and can I use names on this? Is that all right?
Yeah, why not? I'll cut it out.
Cool. Yeah. I'll just say that. Let's skip that. When I was down there, I joined up with the team physiotherapist, and he actually got me a job at the clinic that he was working at whilst I was playing footy. And I sort of just shadowed him, helped him out in the gym a little bit, almost like a bit of a PTA type role.
Nice.
And whilst this was going on, I was studying exercise science in University of New South Wales. So I was down in Sydney for a while. I played down in Sydney, ended up moving back home to the Gold Coast with my parents. And whilst I was there, I finished my exercise science degree at Griffith, transitioned into the Doctor of Physiotherapy degree at Bond University. And that's how it kicked off.
That's how the journey started, mate.
That's how it started.
We should make note on this podcast that Luke and I have actually worked together. We still work together. Glide Physio Clinic in North Brisbane. And Luke's a young rock star up there. He the community loves him. The doctors love him. He's one of the reasons why we got him on this podcast today. So, and I suppose, Luke, what made you pursue private practice, mate? So you talked about like being involved in footy and that kind of stuff, like sporting physio. So what made you choose private practice, I suppose?
Yeah, well, a big reason was when I was a student on placement, if I could take it back there, my experience through private practice, it just really hit me more than anything else. It's such a great profession. We have so many avenues, right? We got hospital, community, neurorehabilitation, cardiorespiratory, mask private, and it just, something really hit me about, I guess, seeing people just straight off the street, first contact practitioners, and being able to get to know them and help them get back to what they want to do. That was a big thing for me. But not only that, I feel like where I gravitated towards, which I guess we'll get to soon, but I feel like anatomy is one of my strong points. And being able to use on the podcast today. That's right. And being able to use, I guess, my skills, I felt like I was able to really use a lot of the tools I developed whilst I was learning and studying under, university people like yourself and other clinicians. And, I was able to really use and hone in all my skills and use it in a way that, I guess, helped people, but also excited me a little bit, because that was something I'm big on and still am. Like I love my job. I love what I do, you know,
Yeah, it's
and
awesome.
if that's how you feel in any profession, I think that's pretty cool.
Yep. Absolutely, mate. And we got a little insight for those watching today. We got a future podcast prepared or drafted for burnout and physio. So that's interesting you say that, mate. Like the passion and loving what you do, and I think that's really important in any profession, right? Not just physio, but it's a whole nother topic for a whole nother day. But
that's right.
Yeah, shout out to those watching today. So talk to me. Describe or can you share a memorable experience with me so far? Like how or what has significantly impacted your approach to patient care? Is there a story, obviously no names of patients and things like that, but is there a thing that sticks in your mind that goes, wow, yeah, that's either changed my way of thinking or that's why I do what I do?
Yeah, absolutely. I mean, there's plenty of stories of patients you meet, and I guess seeing how you can actually impact someone's life is truly an amazing feeling, and it reminds us all of why we do it. Right? It's not to be the you know, for lack of a better word, the big man in the room of, oh, I know your body, I know your health, this is how we do it. But I think what drove most of us to do it was really help make a difference in people's lives. And going back onto some memorable moments, you know, quite recently, if I could share a story of a patient with the vestibular condition. They've been having it now for many years, believe it or not, and they just couldn't quite put their finger on what was going on. They'd been prescribed medications. They tried other avenues, other methods to try and sort out what was really going on. And, you know, we were able to assess them appropriately and really using the proper tools to help them. We made a difference so quickly in their lives, and, you know, it was nice to see. And I've obviously got someone on my list now that I've been working with, a lady for quite a long time, and she was on the downslope a little bit with her balance, her ability to walk or ambulate in the community. And, you know, there was a point where when we first assessed her, I was thinking, she would need an aid in the community. And through quite a long time of working, you know, I'm not saying that we're very close, but I almost feel like I've grown quite close to this particular person, and we've worked really well together. And she's just a completely different person now. Like she gets out in the community, she walks around, she just loves it, and they're the differences I love to see. So
absolutely, mate. And that's really powerful. Hey, to, like you said before, to know that you can make an impact and an impact like that. Like we go back to the start of your story, and nearly every physio I know wanted to be a sports physio, wanted to be in like the sexy business of sport and professional sport. But that for me is like such a more meaningful impact. Nothing against rugby players, of course, but like if you can change someone's ability to walk and live life in the community, that's way more powerful than a footy contract.
Oh, it's an impact. It changes not only their life, people around them. You know, like she can go to a waterfall and do a trek. You know, and these sort of things a year ago were, you know, dreams for her, and, you know, they're becoming realities, which is fantastic. So.
Oh, real. That's cool. That's really cool. So you haven't brought up today, but I'll bring it up. Like you had quite a strong knowledge base at uni with your anatomy. May or may not have won a few awards. So congratulations on that, mate, while we're here. But
thank you.
How does that strong anatomy knowledge or like affect your clinical skills? Or how do you feel like people should handle anatomy? Like I know from my experience mentoring young physios and students, there's this whole like cliche or like demeanor. Oh, my anatomy. Oh man, I have to learn my anatomy. I have to learn textbooks. Like such a negative connotation towards it. How do you think about that, and what strategies do you think physios could use to brush up on their anatomy?
Yeah, it's a great question, and anatomy is a tough thing to learn. It really is. Like it's, you know, they say it's the bread and butter of a physiotherapist, but it's got to be the damn hardest part of the spread. Like it is tough. But there's a fine line for me between what I consider anatomy, like knowing where a muscle is, and functional anatomy, like how does it work? How is this actually operating in the body? And it's that to me, like it's all well and good to, you know, if I can just throw out a rotator cuff muscle, the supraspinatus. Yep, it sits here, right? And that's great. But what is it doing? What actions is it achieving? And the attachment points and insertion points, I know they harp on that so much, but for me as a physiotherapist, I found what's most useful to me is understanding the functionality of your anatomy. If you can understand how they're working, when they're working, and why they're doing what they're doing, it makes our assessments, it makes our treatment methodologies, it makes the patient's overall rehab journey so much more efficient. And as far as students go, I've had a couple of students that I'm mentoring myself. Some further ahead in their anatomy than others.
Absolutely.
But, it's one of those things that I like to harp back on. It is important, right?
Yeah,
it is important to know. And no one's saying you have to be perfect.
Yeah. And like you say, like, you don't have to be perfect, but I think the critical part there and correct me if I'm wrong, but from what I see, because we obviously work together some days a week, is it's that applied anatomy, or that, like, how does it actually affect their function in your day-to-day consultation? Not just, hey, it goes from A to B. Like, it's not that no one cares, but it's useless to you, right? Like, you want to actually know what it means to that patient and what you can do about it with your rehab.
Absolutely. Like, you're spot on the money there. Being able to see something and go, this is what it is, as opposed to this is what it do. And I think so many physios should be more focused on the what does it do aspect of it. There's many a times where I've been teaching a student, and we'll go over something and they'll be able to nail it. The rotator cuff, cool. We've got our infra, supra, subscap, etc. And they're like, cool. All right, what do they all do? Okay. All right. So I've got a patient that's come in. They've got a painful arc, as an example. They might even have a positive Hawkins Kennedy, let's say, whatever the case may be. But they can't abduct more than 90 degrees without pain. You load them through a certain range. They can't do it. And it's like, all right. So what would be involved here? I don't know. That's the part that's important to me, I think, and should be focused. And to be honest, like, only speaking for myself here, that's what helps me learn. When I was going through the nuts and bolts of it all, like, it's a lot to learn. You've got textbooks, you've got cadaveric labs, your specimens, if you're fortunate enough to be in a university like that, obviously learning from people such as yourself. But when I actually applied myself to it, how does it work? It helped me realize, like, if you pinned a muscle in a cadaveric lab, I can know what that is, because this is the action. If that makes sense. That's how I like it. So
it's really good advice, right? Like, there's a lot of I suppose strategies out there that or at least that I've heard, just go learn your anatomy, and they're real generic advice. So that's really good advice, especially for the students out there listening to our podcast. I know there's going to be quite a few. Like, get to know what it does and how it affects the body or a certain body part. So I suppose, obviously, we've touched on briefly on anatomy, because we don't have all day with this podcast, of course, but apart from anatomy, what are some more of the key components to a comprehensive assessment for you? So a client walks into the clinic, or to the clinic up at Glide there, you've got a history. Run me through some, like, things that you want to look at regardless of the body part, right?
Yeah, I think this is an interesting question, because you can almost break down to a few parts here. Like, obviously, you said we've got our history, but one thing I want to make clear, and not to scare any students that may be listening, but nothing is ever textbook. Like, everyone has a different presentation. It's crazy. Like, you think, cool, you could honestly have two, let's call them rec fem tears back to back, and they will both say something completely different. It's never quite the same. But one thing I want to get down to is, once you've gathered your subjective assessment, which is important, don't ever feel like it's not important, because it is. But when you get to your objective, the way I look at it is, provided you're safe, of course, there are no real silly tests. If you have a thought in your head, assess it, check it. There's nothing. The patient won't know. So, like, if you have a thought in your head, seriously, check it out. The more information you can gather, the better you will be able to make a plan. And oftentimes I use my initial assessment as a literally an information gathering session. Yes, of course, you try and get your treatment in where possible, but treatment for me on an initial assessment isn't my primary focus. My primary focus is getting as much information as I can so I can make the best informed decision moving forward. And you may miss things as well, and especially for the new grads, new grads or students, you will miss things. There are times where I sit back after an assessment and go, oh man, I didn't assess that. That's fine. That's what the plans are for, right?
And I tell you, there's a lot of seasoned pros out there. If there's any listening, I know there might be a few already, but like we still miss stuff too, right? Like no one's perfect, and like you said, you've just got to do the best in your consult, but then analyze and reflect back and go, hey, maybe next time I do this, or I could have done this better with that patient. So that's nice.
Yeah, and just be confident in what you're trying to look for. One thing I will say, and I harp on it a fair bit with my students, is I'm pretty big on flags. Knowing your red flags, like knowing when it may be out of our hands. For example, if someone's presenting with leg pain, are we assessing the back? If we aren't, why aren't we? But let's say we assess the back and they are presenting with sudden onset weakness, maybe a couple of drop attacks, their bladder bowel's gone, like things like that are paramount, and I'm big on looking for that. But assessment wise, and I'm not sure if this is going to be a question moving forward, but I'm very big as well as when you get your assessment, you move into your treatment. How do we know if this treatment is actually helping them?
Yes, exactly.
We need to reassess, right? Like the amount of times it's, all right, cool, I'll see you in a week. All right. Did what we do just actually do anything? Or will we just...
I reckon that a stamp some physios have, not to name anyone in Queensland or Australia, but there's definitely a lot of physios that use that stamp and buy it from Officeworks and refill ink and just go, boom, see you next week. Don't know. Let's keep going.
Yep.
And they wonder why their outcomes with patients aren't the most efficient, right, or the most effective.
It's paramount, and it doesn't. And I'm not even necessarily saying you have to reassess at the end of the session. Try a technique, reassess them straight away. All right, nothing's changed. Let's move on to plan B. Because otherwise you can get into that cycle where you're just basically using tools that the wrong tool for the job, if that makes sense.
Literally. It's interesting you say that though, because I'm going to show my age here, but through my time, you speak to different professions, like different trades and things like that, and they have that kind of analogy, right? Like, don't bring the wrong tool to the job, or bring the tool belt to the job. Yet physios, a lot of physios, not all of them, all right, but a lot of physios just bring one or two tools to every job, and they go, I'll just make it fit. Like, imagine if the construction industry did that, how many houses would fall down in Australia?
Yeah, well, it's exactly right. It's exactly right.
For some reason, we think it's acceptable in physio, right? Well, not we, but the profession as a whole go, hey, we'll just do this, or we'll just do that. I'm like, why can't we do all of it, that you're within your scope and monitor it, like you said, and progress it accordingly?
That's exactly right, but
we're going to get you on a rant.
Oh, mate, that's exactly right. But coming back to your original point, how do we know? Reassess. Another big thing I harp on with my students is that reassessment aspect of the consultation, because it's important. And it's important for them too, if a patient, because sometimes people in pain, we do our best, but we sometimes can't change the pain straight away, right? That's just how it is. But if we can show them the value in what we're doing, hey, you come in with 40 degrees of cervical rotation to the right, post-session you're now at 60. I know you're still in pain, but we have made some form of change, significant change. They can see the value in that.
Absolutely. And that's a good point. A nice little segue into the next little discussion is, I find too many physios harp on or focus on, I should say, on fixing pain or helping pain. So what do you think, how do you manage that? I mean, obviously you've probably seen a few patients or clients that go, hey, look, I just want to get out of pain, or I just need this like headache or pain or something related to pain gone, right? How do you manage that, and how do you, I suppose, deliver that in a way with your assessment to focus more on the function and the outcome measures?
Great question. Whenever I'm doing a subjective assessment and you try and actually, something that shouldn't be missed is patient goals, because they are important. And don't just assume that it's, oh, they're in pain because they're here, because everyone's goals are different. But you will hear a lot, I just want to get out of pain. And you're exactly right. Like, how do we measure pain, right? Like, I'm not talking, a pain scale or something like that. Like, how do we actually go, okay, how do I make a difference to this individual's pain? And a lot of the times the way I approach these sort of topics is harp back on something I teach my students is I look for the biggest deficits, right? So whether it be I don't know, let's talk hips, right? Whether it be a hip flexion deficit, and oftentimes when I find these range deficits or these strength deficits or whatever it may be, it's oftentimes due to pain. It hurts too much to keep going. So in my mind, I then determine, okay, if I can make some form of substantial change to this deficit, outcome measure, that is going to in turn make a difference to their pain. Now, there is the rare occasion where it actually makes it worse, and that would be a topic for another day. But most of the time, when you can actually make a change to what you're seeing, and as we know as professionals, there is a deficit here. If we can make a change to that, we are going to make a change to their pain. You couple that, whether we're using manual therapy techniques or whatever we're doing, but you couple that with appropriate exercising. I'm big on, if they're in pain, we want to get them moving, start isometrically. Good evidence to suggest pain relief with that.
Great point. Don't open that can of worms today, mate. Manual therapy exercise, we'll be here all week.
That's right. But so that's how I approach pain, and that's how I try to educate my patients is, look, this is what I'm seeing is your biggest effort. Yes, I know you're sore just sitting there at rest, but if we can make a change to this, we're in turn going to make a change to that.
That's awesome. That's really good. So let's wrap it all up, Luke. So give us maybe one or two key takeaways from today for you for like assessment, outcomes, and like anatomy-based stuff.
I think if the two biggest things I could say would be there is a difference between anatomy and applied or functional anatomy. That's a key point. I think if a lot of physios, especially new grads or students coming through that are watching this awesome podcast, as they come through, if they can really gather that or harness in on the fact that, cool, if I can understand how this works, I can make a positive change to it. That's fantastic. It's all well and good that the super attaches in the supraspinous fossa and heads to the top of your humerus. Great. What to do. That's awesome as well. And I think the second thing is with your assessments, provided you're safe and you've done your flag screening, don't be scared. If you have a thought in your head, don't be shy to assess it. Test it. You're never going to get in trouble for doing too many tests. So, do your tests, get as much information as you can, and use it to help you move forward. If there was something that I could have been found guilty of when I first started, was I had all these thoughts running through my head, and I'm like, oh, I'm not going to assess that. It'll make me look dumb, or that's a stupid thing to do. But no, it's not, because you may be right. So assess.
That's a really good point, mate. Nice way to finish is you can never do too many tests, right? Like, the more information you have, the better decision you can make, and you and your patient can make together.
That's right.
Yeah, nice. Thanks for joining us today, Luke, and giving us your insights, mate.
No worries. Thank you for having me.
And thanks for tuning in to Injury Influence Unpacked. If you enjoyed this episode, be sure you share it with a colleague or subscribe so you don't miss any future tips and insight. Keep thriving, and we'll catch you next time.